think that we have to catch up with that and be a human factor where we need to train the people and get them on board of this long journey.
Thank you very much for your interesting insights. I mean, it's what we all know, but it has to be said on time. So next question goes to Dr. Pfister. We're now talking about artificial intelligence and how it could make healthcare more efficient. Is that possible in terms of cost efficiency and in terms of quality improvement?
Thanks for the question. Yes, absolutely, I think so. So there are a couple of approaches. For example, one way of addressing this challenge is by reducing medical errors, as colleagues from deepC just introduced, and making the whole workflows more efficient with data-driven AI solutions. Another point is that we are lacking physicians actually, and AI could help, not replace physicians, but actually help fill this resource gap with various solutions like workflow optimization, clinical decision support, etc., etc. And another thing would be actually bringing AI and digital solutions to more remote areas where actually high-quality care is normally not accessible. So there are many areas where AI can help making the whole system more cost-efficient, but also improving the quality of care.
Yeah, I think there's a lot to be done, but we're here to start a little spark of that, maybe. So, Professor Böttinger, next question for you. Being a professor for digital health, and I just visited virtually your Hasso Plattner Institute, how has your way of collecting healthcare data changed? In the meanwhile, you're speaking of sensors, we're speaking of wearables, we're speaking of healthcare data itself, and what will be possible in the future?
Well, first let me thank the organizers for inviting me and having me on this panel at this wonderful event here in Munich. Coming from Berlin, you always look at Munich, what are they doing? I know you guys are looking up north, what are they doing? So we're watching each other, Dr. Pförringer, right? Anyway, so we have to be ready to think in new dimensions with regard to data that are relevant for medical care, but above and beyond for health. I think when we look at the landscape of health-related data and healthcare-related data in Germany, it is still by and large data that is more conventional and traditional. It's coming from high-tech, from imaging, from the MRI, from Siemens, from all kinds of conventional diagnostic approaches. And therefore, it serves to rule out or rule in a disease, right? So the data we collect is related to, is there a disease, and if so, what kind of disease, at what stage, and what treatment does that warrant, right? It does not entail any data relating to the state of health of an individual. So we talk about health data, but in essence, we're collecting disease data. So we generally are not at the point where some of our other countries are, where they now are very specifically investing in collecting data, and they call it, I just come back from a big conference on digital health, the Keystone Conference on Digital Health in the United States. They call it data on body and mind, where you collect data now driven through new technologies in ambient computing, digital technologies, sensors, wearables, you mentioned that, to specifically bring light to that black stretch, that distance, the black box in the life of our patients that we know nothing about, that's between doctor's visits, between hospital stays, because we don't collect any data there. And so we know that with the new technologies, this is the area where a lot of new health data is going to be collected. You mentioned wearables and so on. I'm sure we'll come back to this in the course of the panel. But this is the new type of data that combined with the medical care data that we're collecting, in particular in the context of managing diseases and steering therapies, will, in my mind, transform and disrupt the way we think about health and healthcare.
Thank you for the answer. I think one who kind of realizes that up to now is Mr. Holzinger with his RHÖN-KLINIKUM. There's the Innovation Campus in Bad Neustadt in Estonia. He built a brand new hospital with a novel organization structure, totally focused on digitalization and telemedicine. And is this what a hospital of the future may look like? And I think you just integrated a little bit of Dr. Böttinger, Professor Böttinger said.
Yes, I think that's how it might look like. It's the first cross-sectoral patient treatment in Germany, where you have outpatient services, inpatient services, rehab services, combined up front with telemedical services, because 30% of all people now being able to contact doctors by phone for video chat don't even show up in the outpatient center. So it's basically the whole value chain from an economic point of view, but it's also underlying equipped with a full set of digital instruments that all follow my guidance, which is there must be a specific ease of work for the staff and a specific added value for the patient. And we spread these digital instruments across the whole spectrum. Doctors have, for example, online appointments, they have digital anamnesis, they have the medical cockpit, where we use patient data like surgery reports, recipes, whatever, are scanned in 4 large scanning screens to feed the AI systems, because it's the volume of data, first of all, that makes the smart answers. We have it employed in the administration process, that all efforts are coded by semantic coding to make sure we actually build what we've done. Before bills are sent out to the insurance companies, there's another AI tool involved which checks the plausibility of the bill. But also in the by far biggest part of the health industry, which is the nursing, the caretakers, we've started with first digital tools employed. For example, at our university clinic in Gießen, we have stations equipped with a tool that basically helps patients to get away from the red button, where, you know, on the station you have 10 alarms ringing. Nobody, the nurses don't even know what's going on. Is it an emergency or is it a call for a cup of tea? So we've equipped them with tablets, even for the elderly people with large fonts, so they're able to read, and they can basically say, well, I need a vase for the flowers, I need a cup of tea, or it's an emergency.
The patient's got that.
The patient's got that. It brings down the average walking distance for the nurses from approximately 12 kilometers a day to below 9. It's just a simple, small module, but it, you know, for the people working there, it really makes sense to ease their professional work, and that's just a small example. But coming back to the initial introduction, it really has to work for the staff, it has to be an added value for the patients. And by all the hype going on about digitalization, and I'm rather a critic of digitalization, we have to keep in mind the basics, the IT basics are the most important. I see a lot of people in the industry talking about digital health. The matter of the fact is, in most hospitals, you don't even have Wi-Fi working, right? And you won't get the acceptance of the staff for digital tools when they have to wait 10 minutes for an MRI to load on their computer. It kills their motivation and their openness to work with digital tools. So I'm always saying, let's not forget the IT basics, the harmonization of clinical information systems, the speed of internet, and the availability of Wi-Fi in all the clinics before we talk about AI-driven cancer research.
So is it really a role model for public hospitals maybe?
Sorry, sir?
Is it a role model? Can they learn from that? Can it
I'm afraid public hospitals cannot afford it, to be very honest. We can through our business model. It's a whole lot of investment, of course, but looking at the fact that the federal government and the state governments over years now have not been providing the adequate funding for hospital investments. We're talking about a lack of 4 to 5 billion euros per year. I guess most public hospitals really can't afford to invest in these tools because there's no funding for it. There's no reimbursement for it. All we do is paid out of our cash because that's, giving this example in the nursing area. We're all talking now about 100,000 nurses shortage in Germany. And while we're now importing them from all over the world, which actually is a debate going on since the mid-80s, it's not going to work. But the tools that I've just mentioned with the tablet would be paid by ourselves. It's not compensated by the DRG system. And I guess that's one part of the problem. Politicians are talking a lot about digitalization and about making the nursing profession better. But there is no real funding for real innovations.
So can they learn from that, the politicians maybe?
I'm not sure about the learning of politicians. But
now, I think these are some key statements that were made by Dr. Holzinger, is that you take 1 year, you take 10 years, you take 20 years, and in comparison to others, you take even 30 years. And the way the system is organized in Germany is not a market system. It is the so-called self-administration. The duties to actually administer the system are given to those who are also the stakeholders in the system. And so there is no champion at the table to promote change. And hence, the consequence is that if nobody has an interest of the existing stakeholders in digitalization, nobody's going to ask, nobody's going to call for change. And we arrive at a place where we are today. So I would advocate that we have a serious political conversation about, is the current health system, the political system, how it's organized, compatible with the market-driven forces that are driving digitalization, not only in society and industry, but also in health and healthcare elsewhere. This is a serious question that we have to ask ourselves. We cannot just talk around this. It has to be addressed in a fundamental way.
I would like to add to that, and I'm really 100% in favor of what you just said. The German's perfectionism is also a problem. Like, as everybody said, we're looking to Estonia, which of course is only 2 million inhabitants, so a little bit larger than Munich, but they are happy with what they created and pushed it out of the garage, while we're still trying to build the perfect machine and not using it. That's one problem. And the other is also a mindset question that I've realized. I once was part of an investment committee where one company member said, well, this business model that we're right now talking about is threatening to cannibalize our business model. And then another board member stood up and said, well, since the cannibals are at our board already and they are pitching to us, I'd rather have a couple of friends on behalf of the cannibals before they start eating us. And I think that's a really, really important mindset, because you have to be at the forefront of innovation if you want to leapfrog where we're currently at. And I think, Mr. Holzinger is in a very lucky position because he's showing us how to do it and he has the funds to do so. So all we can do is sort of ask if we can catch a little bit of the crumb that he's leaving on the street for us.
Yeah, I just want to add to what Professor Böttinger said. The truth of the matter is the German self-administration system and the health system compared to the free market in the United States or the state system in the United Kingdom definitely has had its merits for decades, no doubt about it. But we're talking about a system that is not really at the moment for the speed of digitalization. It actually kills people because the traditional approval process for the German self-administration takes 6, 7, 8, 9 years. And a lot of the innovations coming up now through wonderful entrepreneurs that we've seen today, and I'm very grateful for UnternehmerTUM because it really, you know, matches my heart. I've been an entrepreneur for a long time. It really kills people because the administration and improvement process is so long that a lot of the people we've seen today on this stage will actually run out of funds, and a lot of the real good ideas will die along with them because they'll never make it through the improvement system. So we definitely need reform, but we're talking about a political vacuum in Germany. And we've seen a study by Foundation München, a healthcare reform foundation in Munich, showing the progress made in digitalization in Europe. And if you talk about Estonia, Denmark, Netherlands, they all have in common that there was a clear political will how digitalization in the health industry should look like. We don't have that in Germany. And where there is a vacuum, vacuums will always be filled, as we know. But this is just far too inefficient for a country like Germany to have this situation going on.
It's a heartbreaking topic with politics and medicine and all that. But I want to shift focus a little bit to the cloud-based platform. Mr. Böttinger, you are currently developing in Potsdam. How can it look like transmitting data from mobile devices to the cloud?
Well, I'm glad you bring this up because indeed we believe that this is where in the future, or even already in the very, very near future, most citizens will have their health data and manage that. And their health data, we're talking about this on the primary healthcare data with the providers in the institutions, but what is in other countries extraordinarily powerfully incentivized is interoperability. In the United States, you have two federal government initiatives promoting interoperability where they want to combat the problem of information blocking that is inherent to actors in the healthcare system. And so promoting interoperability means that the systems that are in the hospitals, in the doctor's offices, in other healthcare facilities have to have a plug and play, plug in kind of technology, that those platforms that are operating in the cloud for citizens that would like to have access to their healthcare data from multiple providers, that is from the doctor on the corner to the specialist to the highly specialized hospital care, and they want to have access and control 24/7 on their smart device. This is a reality elsewhere. I can show you my health record from the United States. I'm American and German. I can show it to you here. This is a reality, and Google and Amazon and Microsoft all now have, with defined standards, made it possible for healthcare data, if the person wants that, to be released out of the primary care systems. They're not being replaced by the cloud solution, not being replaced. It's a technology, a platform that can allow an individual to collect their data and have it at hand when needed and share it, so that the data can be transferred, right? And yes, indeed, we are developing such a cloud-based solution because we do feel and think and believe and firmly believe that this is, in the future, a very, very important basis for an individual to make informed decisions about their health. Not even talking about the improved service that the individual can experience by making appointments and all these things through the smartphone, but also in terms of sharing the health information with people, be it provider, be it other entities relevant to assessing the person's health. So we do believe that part of this is that the data be transferred into a cloud-based system, which then offers a second, in addition to the services and the ease of use and 24/7, offers a second major advantage. This is now bringing me to something that we talk again a lot about. I have been to countless debates and discussions and panels in Berlin and around the capital region and elsewhere. Big data in medicine, what does it bring? Is it coming, is it not coming? Is it, hell yeah, it is here already, right? We just don't have the foundation to experience it, but it is coming. And what does it mean? It means we will have algorithms that are coming from machine learning, artificial intelligence, that can 24/7 monitor our health data, and if something goes in a direction that is worrisome, it can raise concern, it can raise a red flag to the person themselves, but also to their healthcare providers, to their doctors, and so on. And I think this is the real power of having healthcare data in the cloud. It is not so much about, you know, directly being shown, looking the doctor over the shoulder as they perform, you know, their services with the patient. It is much more in monitoring, you know, 24/7, being preemptive if something goes wrong, that we know about it very early and can then intervene before bad things happen.
Thank you very much. That brings us back a little bit to artificial intelligence and Dr. Pfister. So do our medical professionals, which are we, have the know-how necessary to make use of it, of artificial intelligence?
So that's a very good question, and actually I think it should be the other way around. So rather having doctors having the know-how how to use it, actually I believe that AI should be so easy to use, integrate seamlessly into workflows, that every doctor can use it and make it accessible for everyone. So on the other hand, I believe that it would be very valuable if doctors would have a basic understanding of machine learning and data-driven solutions, not to build them themselves, but to understand the value, what AI can do at this point in time and what it can't. And then build such solutions together with data scientists, because data scientists typically don't have any clue about healthcare. So there are a couple of people that know both worlds quite well. So I'm a medical doctor and a data scientist, but usually you need to bring those people together to talk to each other first, to figure out where this can go. And this is where education of doctors could actually help.
Sure. Together with Dominik Pförringer, who's in the back of this room, who's part of the UnternehmerTUM education, we've started exactly that. We started training medical doctors in the field of digitalization, and we're trying to bring these people together. And it's often very fascinating that the bridge is sort of still leaving a gap, and we're trying to at least fill the gap, or at least get them closer. And I really have to agree with what Franz just said. You need to make them talk to each other. And the younger the people are, the earlier they start with these things, the more crucial it is. And right now at this wonderfully innovative University of TU, we're trying to integrate what we're offering is what they call Pflichtwahlfach. For me, an oxymoron in itself, but okay. This is something where we're trying to integrate actually the coding aspect and the digital data aspect into the medical learning process. And we hope that this is going to bring us the fruits that we see down the road. And I mean, of course, that is something when you have some a large group of clinics where you actually have university hospitals as well. That is something where RHÖN-KLINIKUM and Mr. Holzinger, with their vision and their mission, can, of course, train the doctors of the future.
Yes, exactly. I mean, I very much welcome these initiatives, because I'm much concerned that at the moment in most universities offering medical education, we're producing a generation of lost doctors. Exaggerating a bit, but the matter of the fact is they're leaving university with no, at the moment, with virtually no education at all when it comes to AI and health and many other issues. Of course, they can still work in a county hospital in the Outback, but if you want to go to the leaders, you really need the fusion of digitalization and many other things, even robotics, by the way, and health. And the sooner HPI and many others and TUM really make this an essential part of the education, the better. Because we as a company, we're having, I think we've been trying for like a year or 1.5 years to get the positions filled to no avail. So I've started basically buying companies or stakes in companies that have medical data scientists and analysts on board to form an industry alliance. I'd rather have them on board, but there's just no people out there.
So what is to be done? Is it like your digital entrepreneurship with UnternehmerTUM to set small seeds for planting the doctors for the future hospitals?
Well, in parts we hope that we're planting a seed in that and that we're actually fostering the tree, and in the Munich ecosystem we also have the nutritionals to make those trees then grow. But I think we all need to form an alliance, and I have to not interfere, but I have to add to what Professor Böttinger was saying. We're not only watching each other, but we should actually cooperate, and I think we're laying the first small steps. And I mean, here there is 4 people that are in interaction already, and it's constantly, it's a small community. So what we really need is to shape alliances to get it all going, because I think island solutions will not help us, because who's the patient of Mr. Holzinger today might be the patient of my institution tomorrow. You know, and it doesn't help if one system in a closed-loop environment has all the data available, and then I'm switching the system and it just doesn't work anymore, as you described earlier in the train. So, I mean, these sharing alliances and this working together is something that needs to be driven. And I wouldn't wait for politics, because when I listen to what I hear from Berlin is that we need more drones to transport medications through the country. That is a valid point in remote locations of Africa, maybe. But that's not my key problem to get a medication via a drone, because I think very, very few people die because of lack of acute medication in Germany at the moment, luckily. So I'm just saying, let's close the gaps and let's build alliances and do it together, because then we can find solutions that could help all of us and that the society in Germany and then in Europe can benefit from.
Well, sorry if I may, but I can't help but jump in on the Africa comment, because you know, we're flying drones in Brandenburg, you know, so it's a reality.
I never said it's not possible. It's just the need is a question.
No, it is the reality of big problems with demographic change that these federal states face in the eastern part in particular, with regard to Grundversorgung. Right, it's a very, very serious problem, and we are not so far from there. Innovation in digital health coming from there, and why? Because, and that gets to my point, but getting back to the doctors and so on, that creates demand. There's pressure coming from the population. No pharmacy here. We need mail order pharmacy. No doctor. We need video consult. We need telemedicine. No laboratory. We need a device that can be brought to me so that I can have my laboratory taken care of, and so on and so on. So I think I would actually venture to hypothesize the true change in the application of digital health, not in high tech, not in artificial intelligence to read X-ray, but in the Grundversorgung.
Dr. Pfister, we need to remove the fear within the doctors, because I fully agree. The hindering is also within the system, because people fear that they are replaced. And I say, I compare it to a taxi app. I mean, some years down the road, the cab drivers wouldn't want a taxi app. Nowadays, no cab driver that has any brains would run without, because he knows that it's making his business easier and his business better and his day easier. And it's appreciated by the customer and the provider. And I think those are the solutions that we need to come up with, so that we get a drive from within the system to use it. So both from a provider side as well as the patient side. And I'm as optimistic as Franz, and maybe we're just hungry and foolish, but we believe that we will get there. Not maybe within this administration, but maybe within the next.
So thank you very much. Just to bring this into a nutshell, I think it's a little bit of funding. Public hospitals won't afford tablets for the patients. They want to have tablets for the nurses as well. So it's a bit of politics. They couldn't see the benefits right now, so we have to convince them of that. So I think I haven't promised you too much of our panel, of our experts. Thank you very much for your time, for your insights, and you're discharged now, and you can meet the experts at the buffet if you want to do that. I think you're going to eat something. So thank you for your time, thank you for being here, and good evening.
And now we have time to network, to drink, to eat, and thanks for organizing UnternehmerTUM, and thanks for having me.